I look at the whole patient in terms of their function. That is the base training of physiatry, right, is to look at the physical part of a patient. We try to understand the patient's anatomy, their bones, their muscles, their joints, their nerves, link that together and try to find why the patient is actually having dysfunction in their body. I focus mainly on interventional spine procedures, neck, mid-back, lower back. I do non-surgical interventional treatments for pain. I try to find the primary pain generator and distinguish if I can treat it with minimally invasive techniques versus if I need to send a patient to one of our specialists.
Hey, Ms. Calvi.
Good morning.
How are you doing?
I'm good.
Here, the next step would be to do confirmatory. Because
Okay.
it was 3 and it went all the way to 0,
Yeah.
number 2 for like pretty much the rest of it. Now we do a confirmatory block.
Okay.
Right, we want to mimic the same response to make sure that this wasn't a placebo. If it does, then move with better confidence to do the ablation.
We try to look at a patient's function and try to improve their outcomes non-surgically. Use conservative management first, and if we need to progress towards surgery, then we would send to the appropriate provider. People like to play. They like to work. They like to go out and have fun, to play sports. Unfortunately, there are times when you can hurt yourself doing those types of things. And that's where I try to look at a patient from a non-surgical perspective and try to help them out, get them back to their baseline level of function before their injury. We like to spend time at our new place. We like to swim. We like to cycle. We like to go for walks and play with our dog. At this point of my career, I like to spend time together. When I work with patients and they start becoming like family after I've seen them for a couple of visits and they want to hug instead of shake hands, I'm perfectly fine with that. It makes me feel like I'm doing a great job.